Hey everyone, and welcome to this explainer. For the next few minutes, I want you to think of me as your personal pelvic floor therapist. We are going to create a safe, focused space today to talk about a super intimate, incredibly important, and honestly kind of misunderstood part of your body. We're going to break down exactly how you can take back control of your pelvic health using some really clear, structured steps from our source materials. All right, let's dive right in.
So here's the big question. Do you ever leak when you laugh, cough, or sneeze? If you're sitting there nodding your head right now, I want to validate your experience right off the bat. You are absolutely not alone. Stuff like urinary incontinence was incredibly common. To put it into perspective, during late pregnancy, 1 out of 3 women will experience unintentional loss of urine, and that exact same ratio persists straight into the first 3 months after having a baby. But here's the biggest takeaway I want you to get from this. Just because it's common definitely doesn't mean you have to just live with it. No way. We're going to dive into exactly how to fix it together. Section 1. Meet your pelvic floor. Let's take a quick look at the anatomy we're dealing with today. Before we can fix anything, we really need to know what we're working with, right? I want you to picture your pelvic floor muscles as basically a hammock or a sling, tucked right down at the very bottom of your pelvis. They literally hold up and support the whole shebang: your bladder, your uterus, and your bowels. You can actually see how the urethra presses right through those muscles. The really crucial point here is that these muscles control the sphincter, basically the valve for your bladder. Now, when this supportive hammock gets injured or gets weak, maybe from the extra weight of pregnancy or those hormonal changes that kind of soften up your connective tissues, that valve simply can't stay fully closed under pressure. And that weakness right there, that's what directly causes those really frustrating leaks. Okay, section 2, finding the right muscles. It's time to actually locate your pelvic floor. Now that we know what these muscles do, the very first challenge is just finding them. It sounds so simple, but the pelvic floor is totally hidden, and it's super easy to accidentally tense up the wrong muscles when you're trying to activate it. So, first things first, get comfortable. You can sit or lie down, but make absolutely sure the muscles in your thighs, your buttocks, and your stomach are completely relaxed. Okay, step 2. I want you to try to squeeze and lift the ring of muscles around your anus and vagina at the exact same time. The absolute best analogy for this feeling is to imagine you're trying to stop yourself from passing gas in a quiet room, or you're trying to stop your pee right mid-flow. It should feel like those muscles are lifting up and inside your pelvis. Go ahead, try squeezing and letting go a couple of times. But remember step 3, and I can't stress this enough, do not squeeze your buttocks, your thighs, or your stomach. Keep all your focus entirely on that internal lift. Oh, and one quick, absolutely vital warning from our sources. While stopping your pee mid-flow is a great way to identify the muscle that very first time, do not make a habit of doing your exercises while actually peeing. Doing that a lot can actually stop you from completely emptying your bladder, which increases your risk of getting a urinary tract infection, and nobody wants that. Moving on to section 3, mastering your muscle contractions. Let's start building up that strength.
All right, once you've confidently located the right muscles, it is time to put them to work. We're going to outline a very specific, evidence-based workout plan to build up your strength. Because just like any other muscle in your body, your pelvic floor needs actual structured training. And this program, it requires 2 completely different types of contractions. First up, we've got quick exercises. These are rapid fire. You squeeze the muscles tightly for just 2 seconds and then completely relax them for 1 second. You're going to want to do a set of 10 of these. Then we switch gears to endurance exercises. These are your sustained holds. You're going to squeeze and hold for a full 12 seconds, and then give yourself a nice 5-second rest. Again, a set is 10 of these. Now please, as you're powering through that long 12-second squeeze, do not hold your breath. Seriously, breathe freely and normally. If you hold your breath, it actually forces extra pressure right back down onto your pelvic floor, which totally defeats the purpose of the whole exercise. So you're probably wondering, how often do I actually need to do these? Well, that number we're looking at right now, 45 to 60, that is your daily goal for total exercises. Now, I know that might sound like a whole lot, but you definitely don't do them all at once. You break them down. Think of it like this. Maybe do 30 in the morning and another 30 in the afternoon. For each of those sessions, try doing 2 sets of the quick exercises and 3 sets of the endurance ones. Actually, our sources point out a really great tip. Muscles naturally get tired as the day drags on, so knocking these out earlier in the day might just give you better results. And hey, please be patient with yourself. If you do these correctly and keep at it consistently, you can expect to see real, positive results like leaking way less often within about 6 to 12 weeks. Now, while you're busy building up that long-term strength over those 12 weeks, there is this brilliant, proactive little trick you can start using literally today to help prevent leaks in real time.
It's called the Knack.
The knack is basically the clever little skill of timing your pelvic muscle squeezes right before the events that actually trigger your leaks. So if you feel a cough or a sneeze coming on, just do a gentle pelvic muscle squeeze right before it happens and hold it all the way through the cough. If you're pushing yourself out of a chair or hauling yourself out of bed in the morning, squeeze those muscles and hold them as you stand up. Bending down to grab a heavy box off the floor, same thing, squeeze and hold as you come back up. You see, all these activities increase the pressure inside your stomach, which pushes right down onto your bladder. By timing your squeeze perfectly, you're basically pinching that valve shut right before the pressure even hits. Now listen to me. If you forget and a little bit leaks out, squeeze anyway. Seriously, don't feel discouraged. You're basically teaching your brain and your muscles a brand new reflex. It takes a bit of time, but eventually this proactive squeeze is going to become completely automatic.
Section 4. Daily habits for bladder health. So, muscle training is absolutely crucial, but your lifestyle strategies matter just as much. This is where simple, everyday habits can make a really massive difference. First off, you gotta stay hydrated. I know, it sounds totally counterintuitive, right? If you're leaking, why on earth would you drink more water? But here's the thing. Drinking too little fluid causes your body waste to build up, which makes your urine dark and really strong smelling. This highly concentrated urine actually irritates the lining of your bladder and aggressively ramps up your urge to go. So keep sipping fluids throughout the day. Second, try to limit those known bladder irritants. Stuff like coffee, tea, alcohol, fizzy drinks, and yes, even chocolate, can really overstimulate your bladder. Finally, and this is a huge one, eat high-fiber foods like lentils, beans, and veggies to prevent constipation. Why? Because chronically straining to go to the bathroom puts intense downward pressure right on your pelvic floor. You can actually physically damage the exact same muscles you're working so hard to strengthen. If you want to figure out exactly how your daily habits are impacting your bladder, I highly recommend using a bladder diary. It's like a roadmap. By tracking exactly what you drink, when you go to the bathroom, when those leaks happen, and how urgent your bladder felt on a scale of 1 to 4, you can start to spot some really clear behavioral patterns. Seriously, just keeping a diary for 3 days gives both you and your healthcare provider the insights you need to choose the right treatment and get you back in the driver's seat.
Section 5, when to seek help. Let's talk about building a clinical safety net. Okay, while pelvic floor exercises and these lifestyle changes are highly effective, I really want to set some clear boundaries for when managing this at home just isn't enough. Please pay close attention to these red flags. If you're trying the exercises but you just completely cannot identify or feel those pelvic floor muscles, if you are experiencing the involuntary loss of feces or gas, if you feel this increased pelvic pressure or actually sense your pelvic organs slipping down, which is what we call visible prolapse, or if you have uncontrolled pelvic pain that goes beyond a 3 out of 10 on a pain scale, well, it's time to stop trying to manage this all by yourself. These are strong signs of pelvic floor dysfunction, and you really need to talk to your doctor and ask for a referral to a pelvic health rehabilitation clinician. There is zero shame in this, okay? It's literally just the very next step in getting the proper care you deserve. So, I want to leave you with this one question. Are you ready to take back control of your pelvic health? You've got the knowledge now. You know the anatomy. You know exactly how to find those muscles. You have a solid daily routine of 45 to 60 endurance and quick squeezes. You've mastered the concept of the knack, and you know which daily habits are going to support your bladder. I really encourage you to commit to this new routine. Give your body some grace over the next 6 to 12 weeks. Listen closely to the signals it gives you, and please don't hesitate to seek out clinical help if you hit a roadblock. Your body is truly amazing, and with just a little bit of structured focus, you can absolutely regain your confidence. So as you go about your day today, I want you to ask yourself, are you content just surviving your body's signals, or are you finally ready to listen to them and truly start healing? Thanks so much for joining me for this explainer.